Perfect. So I just want to thank you all for coming this Monday lunchtime and to give me the opportunity to share the experiences of the neurodivergent women that we spoke to living in Staffordshire. My name is Victoria Riley, as Fiona's very kindly introduced me, and my email address is just at the bottom of that slide, and I'll also repeat it at the end if anybody's got any questions that they want to follow up with outside of the webinar today. So many of you have probably come today because you've got a keen interest in neurodiversity, you've got lived experience, or you know somebody, family, friend who is neurodiverse. But for those of you that don't, I just want to cover kind of what neurodiversity is. So it's a natural diversity in the human brain. So the idea is that no person's brain is different and everyone's is unique. And in neurodivergent brains, the brain processes, learns and behaves slightly differently than what we consider typical brains do. And neurodivergent conditions include autism, attention deficit hyperactivity disorder, known as ADHD, dyspraxia, dyslexia, dysgraphia, dyscalculia, and Tourette's syndrome. And there are others as well. And at least 20% of the adult population are thought to be diagnosed with these conditions. Research has presented 1 in 7, but chances are it is actually more than that, given the increased awareness that we're seeing currently in the media over the last several years, and the kind of increases in late diagnosis as well. So chances are the 1 in 5/1 in 7 could even be, higher than that. There are significant gender disparities in the diagnosis of neurodivergent conditions, particularly in ADHD, autism, and Tourette's syndrome. They're diagnosed at least 3 times more frequently in males than in females. And this is because the diagnostic criteria is heavily reliant on male representation of neurodivergence than females. And from the literature, we can see that women are more likely to mask their symptoms in early years, so that can delay diagnosis. And in addition to the fact that the diagnostic criteria is then focusing on males, those two combined make it quite difficult. And it's more common for women to be diagnosed later in life than it is males. So for that reason, Support Staffordshire, a local organisation in Staffordshire, were interested to understand the experience, opportunities and support needs of neurodivergent women, to try and understand kind of what their lived experience was, how they're interacting with local services, if they were aware of local services, and what aspects of the support and resources were most important to them. So we very happily were successful with that call for research, and we carried out the community needs analysis on behalf of Support Staffordshire. So we did 16 individual interviews and 4 focus groups with women between April and July last year. And of those 30 ladies in total, most were aged 36 to 45, were white British, in employment, had received a diagnosis versus waiting to receive a diagnosis, or they were self-realised. Most were diagnosed or self-realised AUDHD, and most of them, in fact, realised their neurodivergence over the age of 30. So a lot of late-stage diagnosis representation in this sample. So the findings are very much representative of that. So from the interviews and focus groups, we carried out some qualitative analysis. So we did reflexive thematic analysis. and that resulted in 3 themes and 5 sub-themes, and I am going to talk you through each of these now. So the first one being living in a neurodivergent world, then the next one, navigating neurodiversity diagnosis and support. And within that, I'll talk about experiences with health professionals, accessing support, and the barriers and facilitators associated with that. And then I'll finish off by talking about the women's suggestions for strengthening support. So that included the improvement of existing services and then ideas for future service provision. So to start off with, a lot of the ladies that we spoke to talked about kind of the difficulty growing up, feeling different to others. Some people talked about feeling weird, like they didn't fit in, but not really 100% understanding why that was the case, just kind of feeling like the odd one out. And as the quote said there, just not being able to put their finger on that growing up. And that led to a lot of masking of traits to fit in, so feeling like they had to mask their natural behaviour to feel like they could fit in with others and kind of go under the radar, essentially. Many of the ladies talked about struggling in school during the early educational years without that diagnosis and trying to learn in mainstream education settings. So as a result, several of the ladies talked about having to leave education early and dropping out of school because they just couldn't cope in that mainstream environment without the support that they needed. Many of the ladies also talked about struggles with mental health throughout their life, so having many touch points with mental health, being signed off with anxiety, stress, depression, and that was something that kind of featured in the present time too, with struggles related to just a lack of support or feeling understood by people around them. And people within the health sector as well, and just kind of struggling with navigating that environment. And some participants also reflected on what life could have been like had they grown up with that support and that recognition and understanding, and kind of how much easier life might have been, so maybe not fighting fires quite so often. So as the lady mentions here, so just life could have been much more pleasurable had that sort of support being put in place. So not kind of downplaying the life that they had, recognizing that they've achieved some amazing things and had some amazing experiences, but just feeling like it wouldn't have been quite so challenging had they felt like they'd had this battle all of their life as well. Most women, I think all of but one maybe, described being misdiagnosed with mental health conditions, despite expressing to health professionals that they thought the diagnosis was wrong. So in the quote there, sums it up really nicely. So being prescribed antidepressants, because the health professional thinking that that would kind of solve the problems that they were experiencing, but the participant actually going back and saying, but I don't feel depressed though, it just doesn't feel like that, it feels different. And just not being heard by that health professional and then walking away with just an increased dose of that medication. Some participants felt like their diagnosis or suggestion of going down the path of diagnosis had been dismissed. And that they couldn't possibly be neurodivergent because they'd managed to keep hold of a job, they'd gone to university, they'd had many successes in their life, and that just doesn't translate to being neurodivergent. So kind of a lot of stigma involved there too. And other misdiagnosed conditions included anxiety disorder, panic disorder. Some ladies were misdiagnosed with borderline personality disorder, chronic fatigue, and post-viral fatigue. So a broad range of misdiagnoses that were experienced. There was also references to challenges in working life too. So the ladies talked about struggling to communicate with neurotypical people, and feeling misunderstood, when, trying to be heard by others in the workplace. Some felt supported, with their neurodivergence if, a manager had experience or lived experience, in this area, whereas others felt quite outcasted by, their management or by, others around them, colleagues, and talked about having to leave jobs or not being able to, progress, in their career because of that, which was really quite, motivating for some of the ladies, just feeling like they were being judged, because of being neurodivergent and not just being seen as a person rather than the label. In regards to, diagnosis and support, many of the ladies, as it's nationally broadcasted, it's no kind of surprise that for me to tell you that waiting times, were quite significant for the ladies that we spoke to. They were either waiting a long time before they got the diagnosis for those that were already, diagnosed by the NHS. Or some of the ladies that we spoke to were still on waiting lists kind of 3 years later. And there's obviously lots of consequences to that as well, being on waiting lists for that significant amount of time. So there was lots of, references to the right to choose path, or seeking a private diagnosis to speed up that process and just get that confirmation, of just feeling different. So that was quite a challenge, as well. And for those that had, received a diagnosis, whether that be private or through the NHS, in whichever way they chose to go down, there was variations in how people, responded to that, diagnosis. So, some suggested that it really took an emotional toll. It led to burnout, time off work, kind of questioning who they were as a person, and losing kind of self-confidence as a result of that. While others suggested that it had given them a better understanding of why they felt different and kind of given them that reassurance and validation that actually I did feel different for a reason, and it wasn't that I was weird, it was because I'm neurodivergent, and had I had that support, then I would have been able to navigate that differently. So there was lots of variation in how, the diagnosis was received by the ladies. There was a lot of mixed responses, in references to stories regarding health professionals. So lots of negative experiences when referring to, contact with GPs, particularly as the first point of contact, for a referral to just start the pathway of being diagnosed. Some talked about GPs needing to be persuaded to refer them, for assessment, or just seemed unfazed, by the suspicion of being neurodivergent. So just kind of going through the motions of, receiving the forms, being sent, for referral, essentially. And for that reason, a lot of the participants suggested that GPs could have been more neurodivergent informed, because they lacked awareness of the support that was available, locally, or just more understanding around neurodivergence and more empathy, as a person that's coming to you for the first time, to kind of seek that pathway, to start that pathway, and just feeling like they weren't being taken seriously. There was lots of mixed responses, in reference to mental health services too. So some interventions were found to be helpful, for the ladies that we spoke to, while others felt like it was more of crisis management, with mental health support, due to kind of, putting steps in place to prevent getting to that kind of worse place for people. And I think it probably comes down to the fact that, mental health services we know nationally are incredibly stretched, and that makes it really difficult to support people and to put those actions in place before it gets to that point. But this kind of highlights the consequences of stressed services. So that led to a lack of trust in some mental health professionals from personal experiences. When it shifted in terms of experiences with health professionals, it was when a health professional showed that they'd taken the time to listen to the participants if they had knowledge of neurodivergent conditions, or they actually had lived experience. So whether they were neurodivergent themselves or they had a friend or family member that was neurodivergent. So that's when the shift really changed in people's experiences of seeking health care service support. So it very much was the case that lived experience or knowledge of neurodiversity was incredibly important for participants seeking support. And it made them feel understood and increased their trust in the health professional and what the health professional was saying and recommending to them, because they had faith in what they were saying. There was mixed awareness in regards to the availability of support for neurodivergence locally. So some women were unaware of any kind of form of local support and just weren't aware of anything, couldn't mention any sort of service that would be able to help them. And whereas on the other side of that, there were women that were aware of support and were engaging in local services. And of those services mentioned, it was LifeWork Staffordshire, Staffordshire Autistic Adult Society, Changes, Mentos, Support Staffordshire, and lots of small community groups like A Head Full of Bees. But regardless of whether or not the ladies were aware of existing support, there was agreement that there just wasn't enough out there, and there just wasn't enough opportunities for women seeking support for neurodivergence. And same goes for kind of experiences in accessing support in regards to therapy too. So a lot of the women described having multiple experiences in accessing therapy over their lifetime, but very few had kind of successes from that. And that was for many reasons, including kind of the number of sessions that the NHS are able to provide individuals, or the type of therapy that is routinely offered by services like talking therapies, for example. One that was mentioned repeatedly was cognitive behavioural therapy. Is kind of like a default therapy that is generally kind of started with in terms of seeking support, and many of the ladies just felt like it just isn't appropriate for people that are neurodivergent, because it just doesn't work. The therapy doesn't work for people whose brains process differently. It's very much, the thought was that it very much is geared towards neurotypical individuals. Many participants talked about accessing a lot of support online through communities like Facebook, Instagram, YouTube, Discord. We're all, again, probably all active online in some way or another, and there's lots of variation in terms of the information that's out there and the amount of information that's out there. But one of the ladies in particular questioned whether, health professionals could ever have that kind of information that's found on social media. And just having the ability to kind of be on your phone and access that kind of remote support was really quite reassuring and comforting for a lot of the ladies that we spoke to, because they felt like they could relate to others that were sharing their experience of being neurodivergent, what works for them, what doesn't work, kind of understanding the condition. Whereas there was some reservations in regards to the risk of misinformation, people being online that maybe aren't neurodivergent but maybe claiming to be, but also feeling intimidated by the level of support out there and the number of people that are in these kind of support networks. So that was very intimidating for some of the ladies that we spoke to as well. There was lots of barriers referred to in regards to accessing support, and they included, accessibility of services, so maybe the time or the day that the support groups, for example, were being hosted, the method of accessing support, so particularly if services were quite strict on if it had to be telephone or face-to-face, for example. The anxiety associated with going to a brand new place, meeting new people, not knowing what the place looks like, or never having met someone before. One interesting point was the perceived eligibility of support, so maybe just not feeling like it's eligible for them because of the way services might advertise and present people as, the type of people that might reach out for that support. So to kind of give you an example, if people use kind of photographs of people with like physical disabilities, that doesn't necessarily relate to somebody who's neurodivergent. A lack of awareness of existing support, so as I've mentioned, just not being aware of any kind of local services that can help. The cost associated with support, if it's not on the NHS or if it's private. And the stigma that's associated with reaching out for support as well. Facilitators that the ladies mentioned included having flexibility in contacting services, so whether there was many different methods for getting in touch based on what was most comfortable for the person contacting them. Having a knowledgeable health professional who's either got lived experience or a full understanding of neurodivergent conditions. Accessibility guides, so visual aids for getting to a service, what does the building look like, who is coming to the service, who was, hosting the group, what do they look like, what's their name, that kind of thing. Being in the company of other neurodivergent individuals is also a facilitator, so just feeling like you're being understood, you're with like-minded individuals. Familiarity, which again feeds into the accessibility guide, so just knowing where you're going, who you're going to be speaking to, and trust as well. That was quite a big one, so having trust with the people that you'll be communicating with. So there was many suggestions for improving existing services from the ladies that we spoke to, and there's many mentioned on the slide there, including the speed of the referral process. So some ladies suggested maybe there should be more of a triage service. So it was the understanding that, not every single person that goes for an assessment for neurodiversity will then get diagnosed. So could there be some sort of middle person where they go and have like a mini assessment, and that kind of reduces the number that then go to a full assessment, who should then be responsible for that referral, so including more professionals if possible, that can help out to reduce those waiting lists. Neurodivergent informed health professionals, so increasing, awareness, understanding of neurodivergent conditions through training or other forms of support. Post-diagnostic support, including after diagnosis, or a bit more wraparound support around the use of medication. So some people feeling like, they're trying a new medication for ADHD, for example, but then not having the ability to kind of speak to somebody for advice or to answer questions for a period of time following that. Better signposting to services, so to increase that awareness of services that are out there to support people that are neurodivergent, and neurodivergent friendly organisations. So increasing the number of people who struggle to come to different or new environments, anxiety in unfamiliar places. I do think that's starting to creep. You know, organisations are already cottoning onto that, but just making it more widespread and inclusive. Suggestions for future service provision included more support groups, specifically for women or those that are newly diagnosed. There's also suggestions for support for people that are late stage diagnosed as well. So kind of navigating that kind of emotional impact of finding out that, you know, for 50, 60 years you've been living as a neurodivergent individual unaware of that diagnosis. More community support, so maybe coffee mornings or specific diversionary activities for people with specific particular interests, like the mini zoo or bowling, for example. Having a mixture of online and face-to-face support, so having that flexibility and what kind of suits people's needs and their preferences. One in particular was around the mentor scheme, so support with like general life planning or organising work requirements, anything just to support the day-to-day living and being neurodivergent. Neurodivergent informed therapy to address struggles with the lack of application of CBT. Educational sessions, so, you know, controlling emotions and struggles, overwhelming feelings with neurodivergent conditions, support for comorbidities, so if somebody's got more than one neurodivergent condition, or if they've got neurodivergence in combination with another condition like chronic fatigue syndrome, for example. And then support while waiting for a diagnosis, which again is starting to gather interest, but whether it be support groups or materials, just to give somebody something while they're waiting for that significant length of time before being assessed. So just to summarise the research before I move on to kind of what we kind of recommending on the back of that. So living with neurodivergence brought significant challenges for the women that we spoke to. I think you'll all be in agreement with that. And many felt like all the earlier support and diagnosis really could have eased some of the challenges that they'd experienced and helped them to understand themselves better. Diagnosis was often lengthy and a frustrating process, whether be they were already diagnosed or still waiting for that assessment. But peer support and online communities offered a sense of belonging and understanding for the women that we spoke to. Neurodivergent women were clear on their ideas for improvement, as I've already kind of noticed some of their suggestions. Many highlighted the value of being around like-minded individuals, which would reduce their need to mask and foster acceptance. So off the back of that, we kind of divided it up between short-term and longer-term recommendations based on the viability of some of those suggestions. So sort of more short-term recommendations that we feel like services could put in place to be more inclusive of neurodivergent conditions is to be clearer on communication on local support available, to consider the use of online platforms to provide local neurodivergent women the opportunity to engage with others, you know, for those that don't or feel like they can engage in face-to-face support, to improve the flexibility of contacting local services and organisations. You know, not everybody is able to go to a face-to-face appointment, or they might prefer to have a telephone call, or they might not be comfortable on the telephone, they might only be comfortable over email, for example, and just being really inclusive of that where possible. Providing accessibility guides if services don't already do that, to really facilitate engagement with support services for those that have never engaged with that particular service before. And then to improve access to health professionals during the administration of medications for neurodivergent conditions. So I've already mentioned about the participants' experiences of ADHD medication, and just having somebody, you know, a bit more flexibly on hand to navigate, you know, symptoms and struggles with trying different medications. More longer term recommendations then. So we're kind of suggesting to consider revisiting the referral process to reduce the waiting times for diagnosis. You know, how can we get more individuals involved in that to reduce that diagnosis down, whether as one of the suggestions, maybe more of a triage service to reduce that list. Increase the number of local activities and support for neurodivergent adults. There's probably more available for children that are neurodivergent, although I will stress that is also very lacking as well. But just needs to be more there for neurodivergent adults. Provide specialised support to individuals who receive a late stage diagnosis. So many of the ladies referred to that. So, you know, kind of that real shock factor of, okay, so I've been living with this without knowing that I'm living with this. So what do I do now? Where do I go? Who do I speak to? Like, you know, really navigating those emotions and those struggles. Consider alternatives to cognitive behavioural therapy. Develop a service that helps neurodivergent individuals with everyday tasks and responsibilities, whether that be mentoring or coaching. I know LifeWorks Staffordshire already do that at the moment, but just having something more of that available. To train health professionals to be more neurodivergent informed, and raise awareness of local service provision for neurodivergent women. That's a really big one as well, based on the experiences that the ladies shared. You know, not being recommended to just go online or find a book, for example. You know, there needs to be more than that while waiting for their assessment or after they have been diagnosed. To improve neurodivergent women's well-being in the workplace. And that goes for men as well, being more inclusive of neurodivergence, and then to increase the capacity in child mental health services as a result of obviously some of the things that we saw, some of the challenges that the ladies navigated in early childhood. So I just want to kind of, to sum up, talk to you a little bit about the journey following the research. So once we'd analysed all of the data, we then presented these findings back to the ladies we spoke to, just to check in for interpretation, to give them the opportunity to add anything else to those findings. And we did that on Teams, like I'm doing now. Just because everybody was kind of spread across Staffordshire and different abilities of getting somewhere face to face. And a lot of the ladies talked about kind of just being involved in the research itself was really rewarding, and it had proven useful to them. So just a quote I took there from one of the ladies, that it really helped them to understand and kind of mask less, improve their confidence, really felt like they were understood as a result of kind of speaking to us. On top of that quote there, so, you know, just engaging in the interview and then the presentation itself, not feeling alone. We've presented the research to many different groups and shared it across sectors to try and drive the impact and attempt as much as we can to instill change in this area. It's something that I promised to the ladies that we spoke to, and will continue to try and do so as much as possible. We've also made connections with Keele University, and we're currently in the process of setting up a neurodivergence community of practice group. So just to unashamedly plug that with you. So it's in the very, very early stages at the moment, but if anybody's interested in getting involved in that community of practice group, then there's a number of kind of people. It's open to anyone with any interest in neurodivergence and research. If any of you on the call today are interested in that, then please feel free to reach out to myself or to Katie, and we'll gladly pop you on the expression of interest group when we try to launch the group next month or in April, depending on interest. The journey following the research for participants is probably one that I love most about this research. So off the back of presenting the research to the ladies, one lady in particular said, you know, if anybody's interested in, you know, meeting up or to share resources, anything like that, then please feel free to share my information. So I kind of put out a call for if anybody wants to do this, please get in touch with me. So we initially had 5 ladies get in touch with us, and a WhatsApp group was set up by one of the ladies, and that's where they share events, resources, coping mechanisms. They provide social and emotional support. During that time, one of the ladies, a few of the ladies actually met at Brampton Museum, so quite close to the university, not too far away. And off the back of that, I could just see so much. They were just getting so much from that group that I put the invite out again for anybody else of those 30 ladies that wanted to get involved. And there's now 12 members in the group. So that really just shows how much there is of a need for this, and kind of just seeing how lovely it is to see the social support and the emotional support that they're giving each other. And just, yeah, it's just really lovely to see. It's kind of bread and butter of research, just what we do, why we do this. And they're already thinking of, they're arranging several other get-togethers. So they're going to go pottery painting, they're going to meet up for a meal and a drink. And it's just, yeah, it's just really lovely to see that they've all now got each other in that group, and that I'm lucky enough to be along for that ride and to see it as well. And I think we've got a couple of the ladies on the call today as well, which is really lovely to see. So just want to special shout out to you all for coming. So just to wrap up, the findings highlighted both the resilience of the neurodiverse women in Staffordshire, but also the challenges that they faced navigating fragmented systems from an early age of feeling different, right up to being in your 60s and being diagnosed for the first time. Many relied on informal support, while others were left to navigate the diagnosis alone. So just real challenges with that support that's available, and also the awareness of the limited support too. And improved professional awareness, increased awareness of existing support, and expanding tailored post-diagnostic services would really help to address some of the gaps that this research has really highlighted, and would be really valuable to people that are trying to navigate a new diagnosis in this area. So thank you all